Hi, this is Diane Hitchcock, VP and Principal Analyst at Constellation Research, and I have a very special guest with me, Stace Webley, who's going to walk through their winning submission for Employee Experience Future of Work. Stace, welcome. So why don't you introduce yourself a little bit and your company, and then we'll get into the solution, the issue that you ran into.
Okay, great. Yeah, my name is Stace Webley. I'm the Financial Systems Support Manager at Confluence Health. We're a rural healthcare system located in central Washington, just east of the Cascade Mountains. And we've got clinics and a hospital here in the Wenatchee Valley, but clinics that range from almost to the Canadian border down through north central Washington.
So great intro. Stace, tell us a little bit about the challenge you ran into at Confluence Health that you were looking for a solution for.
Okay, great. In healthcare, the challenge that everyone faces is that we're often asked to do more with less. And that could mean less budget, less time, less supplies or people. And so it's a complex environment and it's always changing. And, we need a lot of resources in healthcare to meet those challenges. And one of the problems that we addressed recently was we have stat CNAs that float from floor to floor in the evening hours trying to locate crucial supplies for patients in need.
And as CNA is?
CNA, Certified Nursing Assistant.
Got it. Thanks. Sorry, go ahead.
Yeah, and so a stat CNA's job is to go where they're needed and find supplies as quickly as possible. And they need to often move from floor to floor and then go and go down to a storeroom and find something that's urgent and get back with as quickly as possible to their patient. So the problem that we had with the supplies is that the stat CNAs would come down to the storeroom, and because this was after hours, the challenge was finding something that they needed quickly. And the resource that they had was basically sheets of paper and a binder telling them where supplies were at. And sometimes that would get outdated or the supply wasn't in the location that it's referenced it in. And that could be because of a stock out or a recent change in shelving.
So we all know how the healthcare system was stressed during the pandemic, and it sounds like, I'm sure that your CNAs weren't any better affected. So they're all these challenges you're facing. What solution did you finally settle on to address those challenges?
Yeah, so we worked with our ERP vendor, Infor, to develop a a mobile solution using their digital assistant, which is called Coleman. And so in our everyday lives, we're all pretty familiar with using digital assistants now and artificial intelligence. We use them in our homes and on our mobile devices. So Infor has developed a digital assistant, which is called Coleman. And we worked with them to deploy Coleman on personal devices. And in a mobile app, they're able to interact with this digital assistant. And while they're in transit to the storeroom or wherever they need to get to find a supply, they ask Coleman, where's this item located? And what used to take 15 minutes or in some cases even a half an hour to find something, if it wasn't in the storeroom, they'd have to go and try to find it in another unit. They can speak with Coleman either through a voice interaction or a chat feature. And by the time they even step foot in the storeroom, they know exactly where to go, and it will be the most up-to-date information on where the supply is located. If they get there and find that the supply is out of stock, there's another skill, is what we call them in Coleman, that they can ask where else in the hospital is this item supplied or stocked, so they can get to that unit quickly and borrow it from them. They have a great deal of confidence in this process. It's proven to work in just a few short months. They're loving it.
No, that's amazing. It's like Alexa, type capability meets the supply chain platform that you had meets the future of work. So tell us about the results. What did you encounter?
Yeah, so they specifically said that it's been less stress for them. They know where they need to be and where to go to get something. So the anxiety has gone down, which is great because, there's some high pressure situations that they can find themselves in, those stat CNAs. And the most important thing is improved patient care, getting those much needed supplies to the patient faster. Other results from more of a business standpoint was this was just so easy to implement and roll out because we're already familiar with artificial intelligence in our everyday lives and digital assistants. So getting this deployed and set up was a breeze. It inherits the same security features that the users have if they're sitting at a desktop. And the training was literally a single session of here's how you access Coleman and here's how you start interacting with Coleman. Just simple to roll out is what I'd say.
Well, I think the results in your submission speak for themselves. I think you said it had 90% faster supply chain processes and you deployed it in less than 90 days. So I thought that was impressive as well. So
yeah, the Infor team was great to work with. And and I just think that solutions like these that are something we're already familiar with that we use at home, it makes it a breeze to implement in the workplace.
Absolutely. Well, Stace, congrats again to you and Confluence Health. You guys were the winner of the SuperNova Award for Future Work Employee Experience for your solution. And thanks for sharing your story.
Yeah, and there's I do the opposite here. There's the award over my shoulder.
Oh, yeah, there we go. Yeah, exactly.
Yeah, we're going to get that down to the hospital and on display.
Excellent. Yes, the Academy Awards of IT Solutions. So,
yeah.
Very good. Thanks so much, Stace.
Yeah, thank you.